let's go ahead and open up the doors to Daily with Doc and Becca. My name is Becca Dukes, and I just want to welcome everybody who is here live with us in the Zoom room. And if you're not live with us and you would like to be, you are welcome to join us. We are at dailywithdoc.zoom.com. Wednesday, Thursday, Friday from noon to 1 Pacific time. So again, that's dailywithdoc.zoom.com, 12 to 1 Pacific time. I am excited to be able to bring to you information that gives more power to you as an empowered individual to be able to make choices in regards to your own health, and also to kind of get an inside look, outside look at some of the things that may be going on around you that you don't realize that are actually negatively affecting your health. Welcome to Daily with Doc. As part of an amazing community, we are a resource for those individuals who are coaches, health advocates, just people that love to love on people and show them that there are other options when it comes to choosing your health journey. So if somebody shared this program with you or invited you to watch this, make sure that you get back with them and thank them for sharing this information with you. And if you want to get started, it's not if, you're gonna want to get started on what you hear in this program. So make sure that you get back with them to get started, as they probably have their own special way of getting product. And we want to make sure that since they took the time and cared enough about you, that they also are able to receive a thank you check for sharing this information with you. And you can do it too. So I love the fact that thank you checks are a way that the company that Dr. Wallach started like 27, 28 years ago, called Youngevity, thanks their field and the people who are part of this crusade for sharing the information. So if you were to refer somebody to a movie or your favorite hair product, do you get a thank you check? I never have. But well, until now, because I do have my favorite hair product within this company, and they send me a thank you check for referring. So I love thank you checks. And it is a way that helps pay for my own product, also helps pay for my home. And there is no income claim here, folks, but we have a lot that we can do as an empowered individual to not only help ourselves, but help our communities. And then together, we can help the world find a better health journey. So hold on and get ready, because today we are going to be talking about something that, when you hear about liver problems, most of the time you relate that to alcohol consumption or some type of chemical interface. Well, not always. And we have with us the one and only, who is one of the founding fathers of the science of epigenetics, the science that proves the genetic theory of disease transmission to be incorrect, not genetic. And he is also the person who found the first non-human case of cystic fibrosis in a Ricci monkey. And he proved that it was not hereditary or genetic. He also proved that it was a nutritional deficiency. So if you know anybody that has little ones, or even have been able to grow up into adulthood, that are dealing with that condition of cystic fibrosis, you definitely want to share this information and this doctor and this program with them as well, because there are things that we as individuals can do to help ourselves. So without further ado, it is my honor and privilege to bring to the screen with me Dr. Joel Wallach in his young 8 decades plus as he's bringing his knowledge and wisdom with almost 32,000 autopsies, whether he was very instrumental in the autopsy himself or in the review of them, and determining and connecting those dots as to when something was missing, which disease was occurring. So, Dr. Wallach, hello and welcome to Daily with Doc.
Well, thank you so much, Becca. Thank you, team. We appreciate everybody's efforts. The world needs us now more than ever. So I appreciate everything everybody's doing.
Well, Dr. Wallach, it's because of you that I'm able to do this. And I wouldn't be able to do this if I hadn't been able to regain my own health from a place physically, mentally, and emotionally that I didn't know that I was going to be able to make it out of. So thankful to you and to those who put you on the radio, because that's where we initially heard about you. I want to do a shout out, as we do have Dave Michaels with KSCO here continuing to broadcast this program out on the airwaves. So we want to say hello to our radio audience. We also want to say hi to those who are watching us out on YouTube and Rumble and Amazon TV, Amazon Music, podcasts. We are on so many different channels, Dr. Wallach. I can't even remember them all. But hey, folks, if you're watching us, listening to us, you know where you're at. Let us know where you're at. So if there's a way to put a comment in there, make sure you send us a comment. I want to thank those who do send those comments. I do see them. I also want to encourage you to subscribe and also share information that you hear about on our program with those that you know and love as well. Well, Dr. Wallach, we had an interesting topic come up from one of our viewers wanting to know about the liver. And I know there's cirrhosis of the liver, but there's fatty liver. Does it always have to be that the liver has issues if you have a high chemical intake or alcohol intake?
We have to appreciate the liver has over 50 different functions. It is your protector against infectious bugs. It's your protector against poisons. It's your protector against nutritional deficiencies, because you store nutrients in the liver when you have them. Excess, you store them in the liver, and you can call them out of the liver when you need them because you don't have them in your diet that week. Okay. And so liver has a huge, enormous function. And, you know, right now, one of the main focuses is on something that doctors incorrectly think is new, or the metabolic syndrome. And I'm the guy who got rid of, as you say, cystic fibrosis. Very, very proud of that. I got rid of muscular dystrophy. Jerry's kids got rid of that disease. I got rid of sediment death syndrome, where the doctors thought that babies were being laid on by their mothers and suffocated. All three of those are just simple nutritional deficiency diseases. And there's hundreds of them, nutritional deficiency diseases that we have. And of course, they've been identified and actually written up in the book Epigenetics. There you go. And also in the book Rare Earths and Cures. In the book Rare Earths and Cures, I don't know if you have that one. You do? Okay, good. Okay. And these two books, plus Let's Play Doctor and the Wallach Revolution, those four books cover the metabolic syndrome, cover all these horrible nutritional deficiency diseases, because this is where I spent most of my professional life working on these things and published. We're going for, I don't know, the 35th book here coming up.
25, Doc.
Oh, 25, not 30.
That's still pretty good for a young guy, okay?
Yeah, okay, 25 books, okay. Yeah, most authors, they do 2 or 3 books and they think they're doing good, which is true. But we're pushing 25, so we're very proud and very happy to be in that area. Now, we do want to just do a quick review here of the metabolic syndrome. Now, the metabolic syndrome covers a vast territory. It covers 25% of the American population are negatively impacted by the metabolic syndrome. 25% of Americans, and there's a very specific what should I say, ratio amongst the racial and ethnic communities, because they're still eating their foods or their recipes from where they came from 10, 15, 20, 30 years ago, but the nutrition are not there. You have to appreciate minerals, for instance. This 2/3 of the 90 essential nutrients, 60 essential minerals, okay, are there. And we've been using them for our health for over 3,000 years. Now, nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. And when we went to electricity in 1882, it got worse because we were getting our minerals, our nutritional minerals, from the ashes of wood ashes and coal ashes, which we've been using for cooking and warmth and all that kind of stuff. And we went to electricity, we lost our source of nutritional minerals that we had been using for over 3,000 years. We had all these diseases pop up, and it drove the doctors, medical doctors, into a frenzy because now they had all these patients they didn't have before. Okay. And so when you look at them, we're talking about, let's see here. Now we're talking about the metabolic syndrome, and type 2 diabetes is a big factor there, type 2 diabetes. We also have liver issues, as you were pointing out. We have triglycerides, which kind of touch on the liver thing, okay, or stroke, hyperthyroidism, high thyroid drives you crazy, okay, and low thyroid, which drives you crazier, high blood pressure, diabetes. Let's see here. I think those are the sort of thing, plus so many birth defects, And these are, of course, in these 4 books, which I'm hoping that everybody will get and use as a reference. You look it up in the indexes of these books, and it'll point you to those diseases and tell you which ones you need, which nutrients you need to reverse them. Okay, none of these are genetic. I'll repeat that. None of these are genetic. All diseases said to be genetic or not. There are no such things as genetic diseases. That was just sort of the fallback position, so doctors didn't have to say we don't know what it is. Okay, and osteoporosis, arthritis, cardiomyopathy. Let's see here. Blood pressure, we already talked about that. Liver disease of all kinds. Triglycerides elevated, stroke, diabetes. I think we're covering the territory here. Okay. And the books, which I just showed you, those 4 books, it has all the answers in those 4 books. If everybody would get those 4 books, okay, Let's Play Doctor, The Wallach Revolution, Epigenetics, and Rare Earths and Cures, and you just look up the problem in the index, it tells you what page you go to, and it tells you what caused it, how to reverse it, and how to cure it. I mean, why would you not want those 4 books right now where there's so much big stuff going on because of the terrible, terrible, terrible stuff going on from the metabolic syndrome. And so this is not difficult. It's kind of like there's so many of these famous people in these books having their little comments before this chapter, and they'd say, why is the healthcare profession so ignorant of the truth when it's been proven over and over and over and published over and over and over? And so all these famous people that we've highlighted in these books, Epigenetics, Rare Earths and Cures, Let's Play Doctor, The Wallach Revolution, it covers all of these diseases and manifestations, okay, of the metabolic syndrome. And we have so many examples where people have had the issues for 25 years, and in 2 weeks' time, it's gone.
Well, for the most part, though, Dr. Wallach, it takes longer than 2 weeks.
Well, that's true. Maybe 3
For
weeks.
the most part. Well, no, Doc, come on. We don't want to over-deliver. Over-promise. Because there are things within the body, Doc, that it does take time for the body to utilize the nutrition that it needs because it's been starving so long.
Yeah, to get on the rails. Yeah,
to get back on the rails. And I
I
just
agree.
want to add in that this program is not meant to take the place of your primary commitment to treat, diagnose, or cure any disease. But when you give the body what it needs, the body itself can do some amazing things. And I know, and I want to do a shout out, pharmacist Ben does not like that disclaimer. He's here with us. So I just wanted to say, hi, pharmacist Ben. We'll have you on tomorrow. So excited to have you with us tomorrow. But Dr. Wallach, when we're looking at the liver, okay, so you mentioned the overlap, the common symptoms between metabolic syndrome and liver conditions, okay? So there's fatty liver and there's cirrhosis of the liver. What's the difference?
Okay, well, they're both caused by the same basic things, nutritional deficiencies and toxins. Okay, the liver is sort of like a filter. Everything that comes in the bloodstream, whether it's, from your stomach or is from breathing or blood vessels, or wherever your nutrients or chemicals or wherever it's coming from, it all goes through the liver. And the liver is a tremendous function. Okay, it also has a gallbladder. The liver produces bile, which helps you absorb essential fatty acids and fat soluble vitamins. If your liver's not working, you can take 5 pounds of fat soluble vitamins a day. You're not going to absorb them because you have to be able to absorb those fats and the fat soluble vitamins. Okay, and so the liver is extremely important. Again, over 50 different things that it's responsible for. And so it requires the 90 essential nutrients, just like your heart and your lungs, your kidneys, and so forth. And you'll see as you go through these books, Let's Play Doctor, The Wallach Revolution, Epigenetics, Rare Earths and Cures, you go through there. In every case, we're talking about some of the things that the liver are responsible for. And you have to take good care of it. The liver needs the 90 essential nutrients. There's some of the nutrients it requires more of. One of my favorite things for the liver is selenium. Selenium reduces your risk of cancer, including in the liver. Selenium makes all of the cells in the liver function properly, including the cells that make the bile to help you absorb the fat soluble vitamins. They're all sort of intertwined here, okay? And it's not complicated, but it is required. Okay, it is required. So that if you're missing something, you get a skin problem, you get a lung problem, you get bone marrow problems, you get blood sugar problems, your thyroid isn't working, and these can all be related to what's going on with and without the thyroid, and with and without the liver, with and without the kidneys, with and without the heart, and with and without the intestines. And so people are still responsible for staying away from the bad foods, even if you're supplementing. Okay, if you want to get the full value of what you're supplementing with, you got to stay away from the wheat, barley, rye, and oats and buckwheat, because they actually kill the villi in your intestines. Okay, the villi quadruple your surface area for absorption, and they secrete digestive enzymes and so forth. And so your villi are very important. But when you eat gluten, wheat, barley, rye, and oats, and buckwheat, guess what? Those villi die. And so now instead of looking like a shag rug, your intestine looks like a glass top on a table, okay? Or a glass tube in a laboratory.
Right. And you've also, referenced the water hose. A lot of people know what a water hose looks like, and it's very smooth on the inside. So you had mentioned something that I want to point out. If we put something in our mouth, or we inject something into our body, or it absorbs into the skin, they all eventually go through the liver.
That is correct.
So the liver is like a filter?
The liver filters things. It sort of is the gatekeeper, so to speak. oh, you go over here, you go there, you stop down here. I want you to stay here in the liver so we can start building more reserves of this particular nutrient. Okay, and so the liver makes all those decisions on each nutrient that comes through. It's going through the large veins, and of course the arteries come from the heart down the aorta and split off into the hepatic arteries and hepatic veins and all that kind of stuff.
And hepatic refers to liver.
That's correct. Hepatitis, viral infections. You can also have a hepatitis that's not infectious. You get an irritation hepatitis because you're eating poisons or, like alcohol and that kind of stuff, drinking poisons. And so that can cause a hepatitis that is not due to an infection. Okay, the liver is very susceptible to poisonous things that you take in through the skin, through your lungs, through your mouth, through your digestive system, through your blood vessels. So your liver is really very important in providing a screen. I guess that's what we're looking for, providing a screen to protect you from bad things that other organs just shrug their shoulders and say, I don't recognize this one, and it can kill you. But the liver recognizes it.
Well, and you've also mentioned how it takes the good cholesterol and converts it into the raw material that's needed to protect the brain for the white matter of the brain.
Myelin in the brain. The liver converts cholesterol, which is an essential nutrient. Cholesterol is an essential nutrient. It's not a poison. It only becomes a poison when you fry it.
Okay, so why frying? Why would frying change that?
Because frying oxidizes, because cholesterol is kind of a liver, excuse me, a fatty acid stuff. Okay, and so when you fry
cholesterol
fat,
is a lipid of fat.
Yeah, when you fry fats, even cholesterol, it turns into something bad from something good. Fats are essential. Cholesterol is the basic factor of female hormones. Cholesterol is the basic factor of male hormones. And so if you're getting on all these injections by the doctors and pills by the doctors to eliminate your cholesterol because cholesterol is bad, it'll clog your arteries, you might as well go to religions that have asexual priesthoods and what?
Becoming celibate.
Yeah, celibate. That's what I'm looking for.
Okay. Well, that is for some people. And that can be a choice, but then sometimes you get forced into that because things don't work because you're not getting the nutrition that your body needs in order for everything to function properly. Is that what I'm hearing?
Yes, you're getting misinformation. And of course, the medical system long has been a source of misinformation. There are no genetically transmitted diseases. Blood pressure is not genetic. Diabetes is not genetic. Heart disease is not genetic. Asthma is not genetic. Gastric ulcers are not genetic. I could go on and on and on. There are no genetically transmitted diseases.
All right. Well, thank you so much for that intro to the liver, the importance of the liver. And Dr. Wallach, so what we eat plays a big factor into the health of our liver, correct?
That's correct. And of course, it's our health also. And
so
go ahead.
You had mentioned, diabetes being a symptom of or associated with liver disease, but there's also fatigue, nausea, diarrhea, all these different symptoms that can be related to other things and maybe, connected with other different poor health conditions. But then when it comes down to it, it may just be the liver, which even if you've got 25% of your liver functioning, it's possible through my research that the liver itself can restore itself with the right ingredients and eliminating the wrong stuff.
That is correct. The liver has an enormous power to maintain and repair itself.
And it's the only organ in the body that can do that.
That is correct.
Well, that's awesome, Dr. Wallach. Thank you, thank you, thank you. So I have here in the chat, I've got Dusty saying 18 months post-liver transplant and have had very distended abdomen. It's been on the 90 for about 2 months. And it's been getting abdominal area drained every 10 days. So
was Dusty diagnosed with
well, apparently
metabolic?
Dusty had or somebody Dusty knows had a liver transplant.
Mm-hmm.
And has a distended abdomen and has to have fluid drains from the abdominal area every 10 days. So if you've had a transplant, Dr. Wallach, would nutrients help? Because I know that they have like anti-rejection drugs and stuff that are given to people who have transplants. If you're building your own immune system,
That's not enough. That's not enough, because when you're talking about transplants, you're talking about the drugs they use to reduce the body's wanting to attack this foreign object, because it's got the identification of somebody else. So they're sticking a liver in you, and your body says, "Oh my gosh, what is this doing here?" And so it sends everything in your body to go kill the liver because it's not you.
right? It's somebody else.
It's somebody else. And so your body's trying to defend itself. And so this is why we have so many problems with transplants, particularly the liver. The liver has so many functions, with blood, storage of nutrients, digestion, the immune system. There's no other organ that has all those functions like the liver has.
So it's pretty important to take care of it, folks. That's what I'm hearing.
Yes.
Well, Dr. Wallach, we have hands up, and I just want to thank everybody, even those, and it was brought to my attention, of course, we don't want to miss Brighteon. We don't want to miss Spotify. Thank you, AJ, for putting that up there. Dr. Wallach, we have hands up, and we just want to remind people that if somebody shared this program with you, make sure that you get back with them and tell them thank you for sharing the program with you. And if there are things that are mentioned in this program or any of our programs and broadcasts that you want to implement into your own diet and supplementation program, also make sure that you're getting back with the person that shared this program with you. If there is no one to thank, you are more than welcome to go to dailywithdoc.com. We do have replays of our previous program, including newsletters or news articles that help to support your journey in choosing things to improve your health. We also have a call team. This call team is available for those who have never tried the Youngevity products. You've not spoken to anybody about Dr. Wallach or the Youngevity products. I have a call team there at 855-949-3377. Again, that's 855-949-3377. And if you have questions that you would like to get answers, and whether we reply with the answer to your question or bring it onto the show, you may submit those questions by going or sending an email to questions@dailywithdoc.com. That's questions@dailywithdoc.com. And if you'd like more information about how you too can join us on this crusade, info@dailywithdoc.com. info@dailywithdoc.com. All right, Doc, let's get to some questions. The first one, we're going to ask Cheryl to unmute. Hello, Cheryl. Go ahead and unmute yourself.
Hello.
Hello, Cheryl. Nope. All right. She's not unmuting herself at the moment. So let's go right over to Kathy. Kathy, go ahead and unmute yourself.
Hi, my name is Kathy Darden.
Welcome back.
Welcome back. I messed up, so I got to start all over again. I just want to know what list can I, the kidney list, can you tell me about it? The new, what all the stuff I need?
All right. Well, Dr. Wallach, Kathy is on dialysis. She is just under 100 pounds. And you have high blood pressure, Kathy?
No, but my sister keep on telling me there's no way I can get off of dialysis. Once I'm on dialysis, no doctors can tell me I can get off of it. I have to stay on it.
Let's see what happens here.
Okay.
Basically, what you want to do is avoid all the bad foods that gets you in trouble, whether you have kidney problems or liver problems or heart problems or not. Get rid of the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, no brown oats, no buckwheat, no sugar, no carbonated drinks. The diet ones need to go. And 100 pounds, I want you to have one healthy brain and heart pack per month. Take a half dose of everything at breakfast, half a dose at dinner time. Okay. And then I want you to take the Ultimate Daily Classic tablets. Ultimate Daily Classic tablets. I want you to take, at your weight, I want you to take 2-3 times a day, 2 at breakfast, 2 at lunch, 2 at dinner time. And it might be like a bottle and a half a month of the Ultimate Daily Classic tablets. That's going to help you with kidney function. And it's going to surprise the dialysis technicians because you're going to show improvement. Okay, we have so many people who have been on dialysis and they get on the Ultimate Daily Classic tablets, but this is something you're gonna have to stay on forever. You cannot just say, okay, I'm doing better now, I'll just drop that. Well, then within a month, you'll be in trouble again. And sometimes you get in trouble, you don't get out of trouble, okay? And so it's
Yes.
I've been taking supplements and I have witnesses, including Becca. I take hundreds of supplements every day. Okay. I've been doing this since I was 9 years old. Since I was 9 years old. Okay. In a couple of weeks here, I'm going to be 85. Okay. And it's one of those things where this is unimpeachable. Unimpeachable. This is nobody. I don't care how many medical doctors there are, how many PhD degree people there are, how many nurses there are, how many scientists there are. They cannot deny the results of all these thousands of studies that have been done by many, many people, not just me by myself, but many people showing the same thing over and over and over. So when you get on this, you got to stay on it. You can't say, okay, things are looking good, I can go back to my old ways. No, 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 don't do that. And that's why you get in trouble again. Okay,
So
back
it does
to
take,
Becca.
see, it
Okay,
does.
thank you.
You bet. Let's hear from you every couple of weeks, Kathy.
Okay, so smoothies and green drinks is okay.
As long as you're sticking with the good foods list in those groups, and then Youngevity has some children meal replacement shakes. They have even a vegan, vegetarian friendly protein shake that they're gluten free, and they go in line with Dr. Wallach's good foods, bad foods list. So you can find those as well with your independent coach or on dailywithdoc.com.
Okay, I had to order that soon because a lot of stuff happened in my life that got to order all this stuff again because again, my niece I moved, she didn't get the bring my stuff with me, and I lost everything. So
That's too bad. Well, we're glad you found us again, and you can get back on track. All right.
Okay, thank you very much. Thank you, guys.
You're welcome, Kathy, and you know how to get hold of me.
Yes, I do. Thank you.
All right. Thank you, Dr. Wallach. And let's try Cheryl again. Cheryl, Do you get a little pop-up? There we go.
Oh, good. This is the first time I've been on your Zoom, so.
How can we
Well,
help you?
welcome, Cheryl.
Okay, I've got a dog question for Dr. Wallach.
Go for it.
Okay, I have a friend who's lived in 3 different states with her King Shepherd, and she's been in South Dakota, Iowa, and Arizona, and her dog has had no problems being in the snow and going on hikes and walks. And now she has moved to Haley, Idaho, and since it snowed, after that, she noticed a sore on his back paw, and she wrapped it up, and overnight he chewed his whole back pad off. And she has been told by vets to keep him in boots and use something called Musser's Secret to toughen his paws up, but they are not healing up, and she is wondering what's causing this.
Okay. What we don't know the dog is being fed. Well, the dog needs to be fed a high quality. I'd go with a high quality canned dog food because we don't want any risk of getting gluten in dry dog food. Okay. Very high quality canned dog food. And it'll tell you how much of that canned dog food per pound or per 10 pounds of body weight. Okay. And then we have, let's see here. What's that one we have for dogs and cats, Becca, that start with an A?
Arthrodex, Dr. Wallach.
Arthrodex. Okay.
Arthrodex.
And so
Arthrodex.
Arthrodex. And so in addition to the canned dog food, you want to get the Arthrodex and give 2 daily doses of Arthrodex to the dog, and it stimulates healing. Okay, it has all these extra nutrients in there that are particularly useful in healing. Now, we keep Arthrodex in the house, even though we don't have any dogs or cats here, because if there's ever a time when, because of shipping or lack of ingredients, the company would have a problem with getting the products to us, I'll eat the Arthrodex. Okay, because it's so good and so wide in the number of nutrients it has. I wouldn't want to take, I take B vitamins. Well, that's not enough. Okay, you need to take all 90 essential nutrients. And so that's why I like the Arthrodex, even for humans, as a emergency resort kind of thing. Okay, so yeah, the Arthrodex and let's see here. Oh, I'd also go with the collagen. Okay, the glucogel. The glucogel, the dog can have 3 of those. I go with 3 twice a day, the glucogel capsules. And that will help regrow collagen in the joints, like the cartilage in the joints and the skin and the pads on the feet. And so it's probably missing the raw materials in the collagen because, when a coyote or a wolf or a wild dog eats an animal it catches, it eats the skin, it eats the bones, it eats the ligaments and tendons, as well as the steaks. Okay. And, it's one of those things where human beings, well, I'm a human. I don't eat bones. Well, they used to use bone broth for thousands of years. They knew that if they drank that bone broth, whatever was in it, which was the minerals from the bones, would rebuild their knees and hips and feet and ankles and shoulders and back and so forth. And that's why I came up with a glucogel, because there were less and less people living on the farm. They didn't have access to, slaughter an animal on the farm, and then they could do their own boiling the bony meats to make bone broth. They didn't need to worry about bone broth anymore because now we have, the Arthrodex. Okay, so I hope that helps out.
Where do you get the Arthrodex?
Well, from Youngevity.
Okay.
Yes, so that is a product in the Youngevity line. One more thing that I would like to add to that, Dr. Wallach, the Arthrodex also has enzymes to be able to break down food for the animals, and I have clients that give it to their birds also. Takes just a little bit. But there is also a product called Perpetual, and Perpetual Plus, they add in antioxidants. Perpetual Plus also includes the I-26 to help for our pets as well, and a tasty chewable for them. So Arthrodex And then Dr. Wallach mentioned the glucogel or the collagen that can be used for healthy bones and joints for them, MSM that can be used for joints and bones. And yeah, there's
Perpetual.
no reason, and perpetual. So there's no reason that our pets can't be as healthy as we are. And pet parents, don't forget to take care of yourself too. Because I know a lot of pet parents that take care of their pets better than they take care of themselves.
Mhm, mhm.
So thank you, Cheryl, for bringing that question.
Thank you very much. This is the first time I've been here, so I'm really excited.
Welcome, welcome, welcome. You're also a new coach with the coaching program. So we're
Amen.
excited.
Yep. Looking forward to that too.
Yes, ma'am. Thank you so much. Well, Dr. Wallach, I have a question from Rebecca. She has been losing weight, not me, Rebecca, another Rebecca. And she just had an appointment, and the doctor is saying that her right arm and right hip will eventually need surgery. She doesn't want to have hip replacement or arm surgery. So she's very upset when the doctor told her this. She wants to know what she can do to prevent future replacements. Now
Okay.
she's 53 years old, 128 pounds at 5'6".
Okay. And we'll assume that she doesn't have any anemia and high blood pressure and diabetes and all that kind of stuff, right?
Does not have any high blood pressure. That is correct. No blood sugar issues as well.
Okay, good. Okay, so get rid of all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, butter, rye, oats, no buckwheat, no sugar, no carbonated drinks. The diet one's got to go. And then 128 pounds I'd have her take because of this issue. I start her out with, if finances are not a problem, I'd go with 2 healthy brain and heart packs. It's right on the border, okay, of 2. If she can only afford 1, that's okay. That's a place to start. But she needs 2 servings a day, either 2 half servings or 2 full servings of the, let's see here, the healthy brain and heart pack. Okay, we'll go with the healthy brain and heart pack. Then I would also go with the glucogel. I'd go with 3 glucogel 3 times a day. If she's at that point where the doctors are wanting to do shoulder replacement and hip replacement, I'd go with 3 glucogel capsules at breakfast, lunch, and dinner. So she'll go through 2 bottles a month of the glucogel. Okay. And let's see here. I would also have her take the CM cream. She can put the CM cream on her shoulder, on her knees, and her hips, her elbows, any place, her neck, any place that she's got pain. And the odds are she's got other stuff going on here, because when you have that much osteoporosis and arthritis in your large joints, like your knees and your hips and shoulders and that kind of stuff, you also have osteoporosis of the skull. And she may have ringing in the ear. She may have balance problems. She may have a loss of the sense of taste. She may be losing her vision. All these kind of things. Wouldn't hurt for her to get the book. See here, it's all in your head, and the CD that goes along with it, because the CD covers the spinal cord, which is something that may be afflicting her also. Okay.
All right. Thank you so much for that, Dr. Wallach. And next, let's go over to Nissim. And as Nissim is unmuting, I just want to invite all of you to our coaching opportunity meeting that we have going on today, April 4th at 2 o'clock Pacific time. So that is 5 o'clock Eastern time. You can go to iwhzoom.com and let them know that the Daily with Doc team sent you. For more information on that, you may also call our call team at 855-949-3377. And that is an opportunity for those who, whether they want to be a coach or just get information for themselves because they love knowledge, it is available to everybody. And there's a special that is available for those who attend to receive the course at 50% off. So that's only like $373.50 for a whole wealth of information and knowledge and become a certified holistic health coach. Nissim, how are you today? Welcome.
Hello, doctor.
Yes. How can we help you?
I have a few very quick questions. I started using your products about 2 weeks ago, and I noticed that, sorry for the graphics here, the color of my urine turned yellowish, greenish, almost chartreuse in color, whereas before it was clear, no color at all. I thought it might have to do with the minerals, but I wasn't sure if this is so, if this is normal or not. I wanted to check that.
Okay, well, it's not unusual when you take supplements to have yellow urine. Okay, it's one of those things where your liver's involved here. Okay, because your liver helps you absorb all these nutrients that are in the supplements, and the liver, when it gets more nutrition, kicks out more bile. And what color is bile? Yellow. So the more bile you have released by the liver into your bloodstream, the more yellow your urine becomes.
It's actually more greenish even. Is that still the same answer?
Same answer.
Okay, good. Second thing, it's about sugary food. You recommend not eating, which I understand, but what about natural sugars such as honey or let's say orange juice or maple syrup? Is that you recommend we stay off of those too?
Yeah, of course. We use honey in the house. We use maple syrup. We use let's see here. We use apples. We use oranges. We use
Okay.
berries. And so sugar in of itself is not bad if you're taking all the 90 essential nutrients, so that your kidneys and your bladder, your liver, your intestines, your pancreas, everything can function properly. And also, you need to make sure that you're getting all the minerals, okay? The 90 essential minerals. And this is why we have the healthy blood sugar pack. Okay, the healthy blood sugar pack is our ultimate, what should I say, our 90 essential nutrients plus the sweeties. The 90 essential nutrients plus the sweeties. Okay, that's the healthy blood sugar pack. And gosh, I've been taking those for, I don't know, 30, 40 years. And again, I'll be 85 in a couple of months and don't have any trace of diabetes, although my urine does come to be more yellow sometimes than others, depending on what I'm eating and what it does, and talks to the liver, and the liver releases more bile to help you absorb essential fatty acids, fat soluble vitamins. And so that's just a signal that your liver is functioning and doing its job and getting that bile out there to help you absorb the good stuff.
Okay, good. And final question, if I may, about raw eggs. At least I somehow remember being told to be careful from eating raw eggs, or when I handle raw eggs, it could be wash your hands so there's no bacteria or something that you should. I mean, you should be aware of that. But yet I know that I think you recommended, or even pharmacist Ben in one of his videos said it's okay to eat raw eggs. So I'm a little confused about that. If you can.
Okay, well, basically,
explain that
again,
to me.
back when I was wrestling and playing football and all that kind of stuff, I'd eat 3 raw eggs, crack them open and trying to intimidate the guys in the other team. I'd just go ahead and eating those raw eggs and everything. But if you have plenty of stomach acid, if there's any bugs in there, the stomach acid will kill them. But there's nothing wrong. Right now, I'm eating 3 eggs twice a day, and we put the let's see here, in the eggs, we go ahead and cook them in butter, not margarine or oils. Cook them in butter, soft scrambled. Okay, soft scrambled in butter, and then I'll have either a steak or a lamb chop or something with it, maybe some salmon. I'll have rice. That's my carbohydrate. Primary carbohydrate is rice. I have rice 2-3 times a day. Okay, so I'm living like an Asian, because the Asians outlive us by about 10, 12, 15 years. So if that's what they eat and they live 10, 12, 15 years longer than us, why would you not eat rice? Okay, but you do have to remember that the rice is going to have different minerals in it depending on where that rice was grown. So you still have to supplement with all the 90 essential nutrients, because the rice grown in Oriental countries are getting different levels of minerals based on whether there's a volcano, whether there's um, minerals coming down in the water from the mountains, and glacial milk, they call it, because it looks like milk. It's white because of the ground up minerals. Okay, so you look at the Hunzas, they live to be 120. We're Americans, we spend millions of dollars on medical doctors each year. The Hunzas don't even have one medical doctor in Hunza. They live to be 120. And we have all these medical doctors, and we rank 47th in the world, the top 100 countries. We list 47th in longevity. Okay, there's 53 other countries whose peoples live longer than we do, even though we have all these wonderful doctors. Because doctors, oh, don't take any vitamins and minerals, don't waste your money, just eat well, get everything you need. That's absolutely positively not true. You cannot eat well and get everything you need anymore.
This is true.
Thank you very much.
Okay.
All right. Thank you so much, Nissim, for joining us here. And let's go over to one of my, well, I have lots of friends, but one of my friends, Dr. Wallach, you know his name, Dave Michaels. Welcome, Dave Michaels. Go ahead and unmute yourself. And what question are you bringing? And I'm going to assume from our radio audience.
Yes, Rebecca. I don't know if you can hear me or not. Can you?
Yes.
Okay. Hello, Doc. My question is about hearing loss. One of my clients came by and asked, what would Dr. Wallach recommend for somebody who is losing their hearing?
Okay, they need to get the book, It's All in Your Head. There's 12 pairs of cranial nerves, okay, including the 8th cranial nerve, which deals with hearing and that sort of stuff. You need to ask her or him if he's got, or he or she's got any ringing in the ears or balance problems, as well as hearing loss, okay? And this is osteoporosis of the skull, squeezing the 8th cranial nerve. I think it's chapter 9. It goes over that in that book. Every chapter goes for one is a heavy description of the normal function of and the diseases of the 12 pairs of cranial nerves. So each chapter is one cranial nerve, okay? And then we have a CD that goes along with it about the same title, It's All in Your Head. Goes into all the diseases that occur when the spinal cord is being squeezed coming out of the back of the skull. So it'll freak you out on page 6. It'll show you a normal human skull, which is 1/4 of an inch thick. It'll show you one that has osteoporosis of the skull, and it's 1.5 inches to 2 inches thick. And all the tunnels, which the nerves are coming from the brain through the skull to the outside where they do their function, they lose 85 to 95% of the internal volume, putting pressure on these nerves. And depending on which nerve you're talking about, okay, and in this book, you will see what disease they get when that particular nerve gets squeezed. Okay, but it's all reversible. We have so many people have gone to experts and they get hearing aids, they do surgeries, they do this and that and the other, and they're missing it by 1,000,000 miles because they're treating the symptoms as opposed to getting rid of the problem, which is the osteoporosis of the skull, squeezing the cranial nerves. Okay.
Okay. Thank you very much, Dr. Wallach.
Hey, you bet. Thank you for calling, and call us in a couple of weeks and a couple of months, and let's have some feedback.
Thank you.
All right. Thank you so much, Dave. And Dr. Wallach, we've got a question that came in about a dog. So a 2-year-old dog has been leaking urine on my bed at night while she sleeps. Any ideas what could the issue be? The dog is about 35 pounds, Dr. Wallach, and only 2 years old.
Okay. So we don't know what is being fed. Is it being fed a complete dog food, or is it being fed table scraps? Could have.
That all plays into it, huh?
Because it could have blood sugar problems. Okay, could have blood sugar problems. Could have osteoporosis of the skull. Again, squeezing that 8th cranial nerve. All right. And so
Could it be like urinary tract infection either also?
It could be, but why would it urinate in the bed at night only, kind of thing? That doesn't make sense.
Well, if the bed, that might be the only time she actually realizes that it's leaking.
Mm-hmm.
So what would you recommend, Doc?
Well, again, the Arthrodex and the minerals, and an ounce of the plant-derived minerals in every pint of water in the drinking bowl, the water bowl, and get those minerals into the body. And it wouldn't hurt to throw in the Ultimate Daily Classic tablets. It's good for the function of the kidneys. It's good for the function of the arteries. It's good for function of blood pressure and blood flow. Ultimate Daily Classic tablets. I love that product.
And at 20 pounds, one per day should be sufficient, shouldn't it?
Yeah, you can start out with one. And if you get a little bit of benefit, then go to two. But if you get no benefit, go to three.
All right. Thank you so much, Dr. Wallach. And let's move over to TC. TC, go ahead and unmute yourself as you're the last caller for today.
I hope my connection's stable. My internet's going in and out, so I hope I don't lose you. But I called 3 weeks ago and told you about my mother, who's 94 years old, had osteoporosis and a blood clot. And you told me to give her the bone and joint pack, Rebound, the Daily Classic tablet, and the vitamin D3. And I've been doing that, but she's been like sluggish and lying around a lot. And she wouldn't get up to go to the toilet that much, but once in a while when she did, I'd ask her if she took them all. She said she took them, but sometimes I saw some of the tablets in the bed, and the drink, she sometimes drinks it all, but not all of it. She says it's kind of sweet. But anyways, we had to have her go into the hospital. Her doctor wanted her to get checked to see if she needed a nurse or rehab. And they found that her calcium was high. 2 months ago, it was 130, but this time it was 270. And her electrolytes were low. And they found some calcified nodes in her neck. And she did have a kidney problem in the past. So I guess, I don't know what my question is, but I guess what I'm getting at is because of the calcium, I know that the supplements have about 1900 milligrams of calcium. And I guess if and when she can get out of rehab and get back on her feet, if she can come home, would giving her the supplements, I know she's on the medicine, she's on Eliquis, Metoprolol, Amlodipine, and Losartan. And I talked to Ben Fuchs last week. He said maybe try to wean her off of those because that's what's really making her sluggish. But if we take her off the blood pressure medication,
Well, that would be the last one. That would be the last one to come off of. And when you take her off of it, don't just go from what she's taking to zero.
He could have a stroke.
Yeah, reduce it by 25%. See how that goes and kind of thing.
Yeah.
Because
Well, she missed a dose of her blood pressure medication before she had a mini stroke. So we can actually take her off the medicines. But if we put her, I mean, when she comes back, if I can give her the supplements, I'm just wondering if the calcium of the supplements and her calcium situation is an issue.
well, I would make sure she's getting plenty of vitamin D3 because she may be, she can be taking in all the calcium you want, but she could be not absorbing it. She could be urinating it out if she's not getting enough vitamin D3 to hold it in the body. Okay, and plant it in the bones. So make sure she's getting, we have a wonderful vitamin D3. I take 3 of those twice a day. Okay, so I only weigh 138 kind of thing now, 140 kind of thing.
Okay. Now, should I keep her on the classic tablet and the Rebound and the bone and joint pack?
Oh, absolutely.
Okay. Okay. Because Ben was saying put her on the Healthy Start pack. I don't know which.
The Healthy Start pack is included in the pack that Dr. Wallach recommended. So,
but I should include the others with it. Okay.
Yeah. So I have a question for Dr. Wallach about this. Dr. Wallach, when the body's not absorbing calcium, isn't there a certain part of the body that actually tells or controls that calcium absorption?
Yeah, of course. That's the bones, of course.
How about is it the pituitary gland?
I don't think so.
All
It's,
right.
it's bones have to do with it, and it's one of those things where even the pancreas might have a little bit of something to do with the calcium being absorbed and so forth. But at any rate, it's one of those things where, if she's eating bread or crackers or cookies or potato chips or pancakes or waffles and muffins and spaghetti and all that kind of stuff, her villi are dead. She cannot absorb stuff. When you can't absorb stuff, you lose it. Your liver takes it out of the rest of your body and uses it and then flushes it out of the body.
All right. Thank you so much, Dr. Wallach. And we are at the end of our showtime with you. Our time, I know your time is precious, and we appreciate every moment that we get with you. So thank you, Dr. Wallach, for another great show.
Well, thank you, Becca, and thank you, team, and thank you, all of our callers. We really, really appreciate you and respect you for wanting to, ask for some outside information. And, just keep in touch with us, because sometimes it takes a little bit to heal those intestines, stop getting rid of, get rid of all the bad stuff. And it might take you a month to regrow those villi. It might take you 2 months, depending on how long you've been on the bad foods. It might take you 2 months to regrow the villi so you can absorb the nutrition.
That's correct. Well, if I can get my co-host on the screen with me, Dr. Wallach, we will see you next week. I know that you've got lots of things going on, including writing that new book that I'm excited to be part of and get available to the world. Thanks, Doc.
Thank you. Yeah, it's gonna be a lot of fun when this one comes out, because again, it's like the glucogel. Yeah.
It's like it's all in your head.
Yeah, well, it's like the book is on your head. It's one of those things where the disease where the mothers are supposed to be laying on the babies, the muscular dystrophy, the cystic fibrosis, all those things. It took me like a year to go through all that and figure it out. And they fired me for figuring out what was causing all these things. Instead of giving me an award, they fired me. Said, "Well, you're out of your mind." Okay.
Well, I'm glad you're out of your mind, and I'm glad that you didn't let them stop you, Dr. Wallach, to continue this. Folks, you can find Dr. Wallach's books at drjwallach.com. That is drjwallach.com for all of Dr. Wallach's publications. So see you next week, Doc.
Okay, thank you so much, Becca. Thank you, team, for everything. We love you all, and let's go help some more people. God bless.
Yes, sir. We are taking on your command. Thank you, Doc. And if I could just have a brief moment to say thank you to my team, as they do so much around the clock. We almost have round the clock phone team right now. So we're excited to be able to offer that with Albert coming online on that phone team. And I just want to thank the person that has been so instrumental in keeping us organized as a team, making sure that we stay on task. And that is my dear friend and chosen sister, Ruth Ellen, who is our executive production manager. So thank you, Ruth Ellen, for doing that. I will also want to thank the assistant to the executive production manager, who has been instrumental in getting this program on all of the different platforms and beyond, including TV. So I guess TV is a platform, right, AJ? Thank you so much, AJ, for all that you do and getting that newsletter out also to our listeners. And if you'd like to be part of our email newsletter subscribers, that's the word, go to dailywithdoc.com and you will find the option to sign up for our email list, and also can submit questions there too. And then Albert, thank you for being with us. I know it's in the middle of the night for you, but coming and making sure that people are getting into the show in a timely manner and keeping an eye on those videos, make sure everybody is staying on task. And I cannot, and I'm last but definitely not least, we have our Marilyn, who we lovingly consider Fingers, as she does such a great job on the transcription of what is being said within the program, putting that into the live Zoom chat. So if you are interested in getting that information, you have to be here with us. She does a great job of typing that up and allowing it to be available so that if you're here with us, you can do a screenshot, take a picture of it with your camera, and then get with the person that shared this program with you and say, okay, this is what Dr. Wallach just recommended for either myself or someone who has similar conditions that I'm experiencing. Can you help me get it? And absolutely, they will be happy to get that for you. So again, get back with the person that shared this program with you. If there is no one to thank and you have not been in communication with anybody about Dr. Wallach or Youngevity or the products or pharmacist Ben, feel free to go to dailywithdoc.com, dailywithdoc.com. We do have a full store there, or get in contact with one of our health coaches and make sure that you're choosing the things right for you based on Dr. Wallach's teachings at 855-949-3377. My name is Becca Dukes. As the hostess of this program, a lead trainer for the Daily with Doc team and Critical Health newsletter team, and the Institute of Holistic Health trainer and director of student services, I want to commend you for taking this time, investing in yourself, because not many people will take an hour to learn about what they can do to empower themselves. So share this information with your family, with your communities, and together we really can make a difference in this world. Bye for now.